last 2 days driving around the highways and byways of Missouri, we find that that is really critical to really experience how Missouris are living with COVID and really understand that. We've been to Branson, we went to the Lake of the Ozarks on the way up here at 5:30 this morning, and we really had great conversations with the governors, his cabinet staff, and with community experts, and it's been a privilege to be here. I think many of you know that post-Labor Day, post-Memorial Day, there was a significant outbreak across the South, and different from the outbreak in March and April, and that's why it's really important that Missourians understand that. The outbreak in March and April was very large metros in the United States, from Detroit to Chicago to Boston to New York to Philadelphia to Baltimore to Washington, D.C. This particular outbreak that began after Memorial Day was really a reflection of Americans moving into summer and traveling around the country. And so across the South and up the West Coast, from Washington down to California, from Arizona, across to Florida, up to Georgia, South Carolina, we saw a diffuse spread of the virus. First among asymptomatic young people primarily, and that's why it was only visible by increasing what we call test positivity. The ability to really see that the number of people in that particular state or county had an increased test positivity. We've been working across the South. This is my 20th state to be in. 8 weeks ago, we began publishing what we call the Governor's Report. These are reports directly to the governors every week for the last 8 weeks, and obviously we still continue to have the Vice President or the President-led calls with each of the governors every single week. But the President and Vice President wanted me to go out state by state and really meet with communities and leading officials, mayors, and governors to really understand what was happening in their state and understand how to improve mitigation against this virus.